Hi, I'm Dr. Lynn. Thank you for visiting Lynn Dental Care's website. You clicked on the high technology section, specifically Diagnodent. So let me introduce you to my little friend here. This is a Diagnodent machine. This device solves a problem that dentists have had forever, and that's determining does a tooth have a cavity or not. Today, with the advent of all the fluorides that we have in toothpaste and in the water, the outer layer of enamel of the tooth is often very hard, yet things can be brewing underneath that outer layer of enamel, and decay can be starting and growing quite deeply. The problem is, heretofore, the traditional way of diagnosing a cavity was, could your dentist stick and explore the little picky device that we use day in and day out in the tooth? And if it didn't stick, it didn't have a cavity. Well, that's not always the case, as I'm about to show you. This device has a numeric readout. It uses a laser light that picks up the presence of bacteria inside a tooth, and then numerically assigns a number from 0 to 100. It also has an audible sound. So it's been a very useful tool and has given us many ahas in the course of daily clinical life of dentistry here in our office. So once this device has been calibrated, then we go to the patient's mouth and we put it on a natural tooth. I'm going to use my fingernail just for fun. And we calibrate it to a tooth that has no decay whatsoever. And then you see that 0, 0 is a baseline reading. And then we'll go to the area that we're suspicious of, and I'm just going to scan the green color of my shirt, and it just went nuts. That 99 and that high tone that you're reading there is a very deep cavity. Okay, but this is just the same color as bacteria. So I told you I was going to show you an example of one of the dilemmas that we face every day. And as you can see over here on the screen, this is a tooth of one of my patients that I did some photography on. And I had this little area I was really suspicious of. You can see it's kind of dark, but again, the classic, our little traditional pick did not stick in that little dark groove right there. So I took a series of pictures. Of course, the patient's been numbed up, and we're going to fill this cavity. Because I've used the Diagnodent, it read about 45 on the scale of 0 to 100. I know there's a cavity in there, but I want to show you what happened inside that tooth as I went in. So this is the next photograph you can see in this area. That's not a normal appearance right in there. That's actually a cavity, and I'm going a little deeper. We're cleaning it out as we go. You can see the reddish-brown material. That's not normal. That's decay inside that area that was, visually only borderline suspicious. And look how big that cavity ended up being, and I still don't have it cleaned out yet. And then finally, this is after we got it all cleaned out and all the grooves cleaned out and disclosed with the decay dye that we use. And look how big that guy is. So the patient's real glad that we detected that early, and this is as it's restored after the filling has been placed. So one can see the extreme importance of diagnosis and how Diagnodent aids us in being accurate in that diagnosis of simple decay. So you can see having this information available gives us important information as to whether there is a cavity present and really relatively how deep it is and the urgency of that decay in your tooth.